Hi, welcome to EMDR Chat with Curt and Michelle. I'm Dr. Curtis Rounzen.
And I'm Dr. Michelle Gottlieb, and we are excited to be here because we have Wendy Byrd, who, if you guys remember, a couple of months ago, we started to talk with Wendy about EMDR therapy and psychedelics. And this is a topic that was so exciting and so much interest, and we had so many questions that we invited Wendy to come back to do a part 2. And
Yes,
if
we
you
did.
have noticed your mail in the last week, there was also EMDRIA obviously has decided this is a big topic as well, because Go With That magazine is all about psychedelics. So first,
The whole
Wendy,
thing.
it's so exciting. Wendy, thank you for coming back and spending more time with us. We really appreciate it. And we thought we would start with, let's just do quickly to kind of remind us, what is a psychedelic assisted session look like? What could someone expect?
Yeah, it's a great question. So when someone comes in and they're interested in doing, the only psychedelic that's legally on the market is ketamine right now. So they come in, they generally have already done their medical intake and gotten the approval, and we've already done their treatment planning. So we sort of know what we're looking at, why we're doing what we're doing. They come in, I meet them at the ketamine clinics that I partnership with. So I drive over there, they meet me there. We have generally, by that time, we've done a little bit of work on what we're trying to get out of the ketamine session. Usually, maybe we know that there's some big memories that we're wanting to work on. Maybe, we've already done some of that pre-work, and then we come in, we do a lot of check-in first. So the set and setting is very, very important in psychedelic work. So what their mindset is, that's the set, and what the space looks like. And so we are very intentional with coming in into that space. We get them nice and comfortable. And then we usually do about 20 minutes of talking about, whatever it is that we are working on. Oftentimes, we have already discussed a little bit of an intention. So we've sort of put some of that information already out there. I usually kind of have my clients think about what their intention might be. Then when we come in, we kind of ground into that. And I kind of think of intentions a little bit broader than positive cognitions, but they're sort of in the same themes, right? Oftentimes around worthiness or safety, or feeling like they have some agency or power. So it's usually related to what our overall treatment plan is. And then once we're all ready, they are laying down. We get them very comfortable, use smells. And then we have set up playlists, ketamine playlists, which are music. There's a lot of music out there that are specifically dedicated to psychedelic use. And so I usually kind of pull out some music that I think would be helpful, depending on if we're looking for a little bit more intensity, or if it's our first session, maybe we're going for just going in and being able to have the experience so it's a little lighter. Music is kind of referred to as the third therapist in the room, or the third person in the room with psychedelics. So it can be really, really powerful. And so we kind of set it up to kind of ease in and then build and then come back down, because that's going to be what the journey looks like. So they get their headphones, they get their eye mask, they are all comfy. Ketamine can make you a little bit cold, so I always make sure that their feet are bundled up, that they're comfortable. Then we call in the medical person. The medical person administers the medicine, generally takes their blood pressure, Depending on where I'm working, they'll have a little blood pressure cuff on that's monitored constantly, and little electrodes on their chest that's checking their heart. So there's the nurse practitioner who's kind of always monitoring even when they're not in the room. The ketamine journey itself, generally depending on what kind of modality you use. So most of the time my clients are having intramuscular, a shot, or IV, intravenous as a continuous drip. So we get all of that set up, and then we send them off to their journey. I generally work with a psychedelic dose. So 0.5 milligrams per kilogram of body weight. So that's kind of where our starting point. And we discuss, do we need to go down? Do we need to go up with that? It's usually talked about as a team. So the medical provider, the client, and myself, we discuss, where and why. We think we might want to go around that dosage. The dosage usually, depending on, where we are, we're looking at 45 minutes to 60 minutes of a journey. There's some new research out by Robin Carhart Harris that says that if you actually bring up a memory while you're in the middle of your journey, it's kind of like some of the memory reconsolidation things that we use. It makes that memory more pliable, right? So if the client has agreed, we might go, I'm going to set a timer for 15 minutes. In the middle of our journey, when that timer goes off, we have agreed on what memory we're wanting to access, and we have created a positive cognition with it. So I want to access the memory, and then I want to bring in the positive. So the timer will go off. We'll sort of have a clap, bring up the memory, take a breath. Now let's go into the positive cognition. We do that. We take another breath and we let it go. We're not going to do anything else with it. That's one way that we can sort of bring in some things right in the middle of the journey. And research is sort of showing that can be helpful to change that memory. I don't do that with every client, but sometimes if I feel like it's going to be really helpful and there's something that we're kind of a block, or we know this is going to be a challenging memory, we have the option to do that. And I talk to my clients about it. But then they continue on their journey. Sometimes they will need some to go, Wendy, hold my hand is one of the things, right? Because we're kind of going out. Ketamine is it's a dissociative, so they kind of leave their body. They will want to ground back in. So we will have made those kinds of choices beforehand. I'll hold their hand. I might need to change the music if they're getting a little bit, too into music and it's becoming uncomfortable. We kind of talk about it before. So then they go through the journey. They start coming out. Ketamine has a pretty short half-life. So they start coming down from the sort of curve, usually around 45 minutes, or the IV runs out. It takes about 10 minutes for them to really be able to come back into the room. And then they check me in on what their journey was in any important pieces. Sometimes something really came up that was really kind of profound for them, or they found I've had people say, for example, I've never been able to access loving myself, and I felt it. And so we'll later on use that as a resource, right, to get back. I might even resource it right there before we leave the session, because I'm wanting to take advantage of getting it into, installed right there. So we spend about 30 to 40 minutes then doing integration work. Sometimes that might involve a little bit of going in and doing some processing, but a lot of times it's kind of getting the important pieces out for what their experience was. And then I will have an EMDR session set up for them maybe the next day. There's some really lovely windows that we can take advantage of. Some is right after the journey, but up to 72 hours, the brain stays pretty pliable. So I try to get them in to do a more traditional EMDR session within that window. So that's kind of what it all looks like.
That's fascinating.
Yeah, that's really helpful.
Mm-hmm.
That's really helpful. As you were doing this, and you speak so expertly about this, what kind of training goes in to have someone that can do this kind of therapy, Wendy?
Yeah, well, there's not a lot of rules around what training you get at this point, but I suggest that you work with a training where you're going to actually be able to have an experiential experience.
Mm-hmm.
I think it's very, very valuable. I have a training, so if you want to know more about my training, I'm happy to it's on our website, Connected Heart Therapy. And then there's some really great trainings out there. I think it's Integrative Psychiatry that has a year-long program on all psychedelics. So there's some really long trainings. MAPS was doing the MDMA trainings for a long time. I think they have put that on hold. But I definitely think MAPS is one of the organizations to follow.
Can you say what MAPS is?
Yeah, it's the Multidisciplinary Association for Psychedelic Studies. Psychedelic studies or psychedelic science. One of the two.
I get that. Okay, cool.
Yeah, one of those. I think it's science. So MAPS does a lot of the research. They've been trying. They're the ones who tried to bring in MDMA, and then it didn't get passed through the FDA. But I suspect,
got it.
Yeah, I suspect that we're probably going to see some more of that coming around. They just wanted some different things out of their studies.
And what's some of the biggest misconceptions that you've run into when it comes to therapists or even patients around psychedelic-assisted therapy?
I think for trauma therapists, one of the things that I hear the most is that it's dangerous. I would, there's a little bit of fear on the therapist side. And the amazing thing about ketamine is it's actually really, really safe. The World Health Organization has called it one of the imperative drugs for the world because it has so many uses. And from a physiological medical standpoint, it's a very, very safe drug. And because it's called a dissociative anesthetic, trauma therapists sort of go, well, why would I want to induce dissociation? But we're not there. You have to think about it from the lens of dissociation from trauma and then dissociation from a release from sort of your normal state of consciousness and ego. And there's ego dissolution that happens with ketamine. And what is really beautiful about it is from the medical standpoint, we get all of this neuroplasticity. But from the lived experience, you get a break from your thinking brain, and that's the dissociation. And that break from oftentimes constant rumination that a lot of our clients have, right? A lot of pain, anxiety. When they get a break from that, it allows them to have an experience where they can actually find something different. And so the dissociation is actually a positive thing with ketamine. And so that's where, sometimes that self-love or compassion or forgiveness, those kinds of things that we see start happening in EMDR start coming online after the trauma, right? They get to have that experience right there in the session because the default mode network of the brain kind of gets shut down. And that is the network of the brain that's our constant chatter, kind of people refer to it as our ego, the ego part of our brain. It's what comes alive when we're very quiet. It's why people who have high amounts of trauma, for example, don't do well in meditation at the beginning, because when they quiet their brain, boom, the default network goes off and they are in literal misery, right? So that gets quieted down, and that may not have happened for someone for years and years and years, for example. And so explaining that to therapists, I think, in the distinction, yes, we're using the same language, but these are not the same processes, is really important. And then for clients, understanding that it's not going to be a magic bullet. We're still going to have to do the hard work of going in and cleaning up, right, the memory system and what happened. But I think about it like putting water on really hard clay. If you're trying to shape something and it's very hard and it's brittle and it's breaking, that's not working. So the ketamine is kind of like, it softens the brain up, and we can move things around a little bit easier.
I love that metaphor.
Without,
it's great.
yeah. So that's kind of how I describe it. But if psychedelics were magic and you just did them, and we'd all be,
done.
We'd probably all be in a whole different place.
Well, Wendy, I think my generation tried that many years ago.
Yeah,
and it wasn't successful.
Yeah. And people will come in and say, some of the most important experiences of my life have been on these medicines when I took them recreationally.
Right.
And I sort of go, well, imagine if you did it in a therapeutic setting where we were very intentional with what and why we're doing and how we're doing it. And you're doing it with someone who's trained to understand what trauma looks like, how your body reacts, and how that would be very different.
So,
So
going from there, and you've touched on this, but what is that integration of psychedelics and EMDR therapy? Can you talk more about that?
Well, my experience is it's such a beautiful combination. I feel like they were meant to be married. And I think that a lot of the research that's been done with psychedelics so far hasn't really understood how much EMDR therapy and EMDR therapists belong in this world, because we already come in with the training and information. So like I said, if someone's coming in and maybe they call me because they know I work with ketamine, most people call me because they know I work with EMDR. And not everyone needs or should have ketamine. There are some reasons why we wouldn't integrate these two things. But depending on what our goals are, what the client needs, we can start talking about, would it be helpful to integrate ketamine into our EMDR treatment plan? And if we agree that, I think, it's going to help us move faster. It's going to make the whole experience a little bit easier, again, because we can go into painful things without so much intensity using the ketamine. Then it's going to look like we have our treatment plan that we've created with our client that we all do all the time, right? That's an EMDR based treatment plan. And then we're going to look at how can we bring in ketamine sessions. Usually we recommend at least 6. And some of that's just because that's how the studies were done so far. It's still all new, but 6 sessions. And so we look at making our treatment plan and our appointments EMDR, ketamine. That's how I do it. Some people will do the ketamine and the EMDR all in one session. I have found for my clients and me, it just feels a little bit easier to do it in that 72-hour window. Language can be hard to bring online after you've had ketamine. People are trying to integrate a whole lot. So we can bring some EMDR techniques into the journey. But to do a full EMDR session, I usually do it 24, 48, 72 hours later. And so we set up a plan where that's what we're going to do. We coordinate it with the medical team. We all know what we're doing. And oftentimes I'll do an EMDR session where I know we're going back into some young things that are going to be big experiences that we need to reprocess, right? So we'll do an EMDR session. We'll then have our ketamine set up the next day or 3 days later, whatever the cadence is that works. We do the session based on where we're working in the treatment plan. And then we have the journey. They always check in with me the next day if I'm not seeing them to let me know how they're doing. Right. We set our intention with the ketamine. We know we're working on bringing in worthiness. I'm good enough. Or whatever it is. So that is still present in the ketamine journey. And then we meet again and we pick up right where we left off with EMDR. But we have these new resources. We have this new experience, and we know the brain's going to be more pliable and we're going to be able to change it.
That.
And and it's so wonderful because the EMDR sessions will look very similar. You might see it moving a little faster, but what happens is a week later when you do your reevaluation and you check in, all of these insights have come online, or a lot more positive. Some of the things that we start looking for. Well, I didn't get reactive when this happened. I didn't ruminate so much. Right. So all of those things that we kind of look at, that I kind of call our litmus test for how is our client doing, because we're only doing all this work to change how they're showing up, right? Right. So you start seeing that coming online. And it's just, we just all kind of smile and go, wow.
So we just have a couple minutes left.
That's so fascinating.
It really is. I'm fascinated by all of this. But as I said, we only have a couple minutes left. Is there any ethical warnings you want to make sure people are aware of?
I think just make sure that you get really good training and make sure that you are talking to therapists who are doing the work. There's a lot of ethics, so we could go into it for hours and hours, because it is a little bit of a different, most of us were taught you cannot do therapy with someone who's under the influence of anything. And now here we are, doing therapy with people who are under the influence of this medication. And so you want to talk about that with your client. You want, for example, with my clients, I know that they might need me to hold their foot or hold their hand to ground them. We talk about all of those kinds of things. So touch becomes a different experience with psychedelics. And then, I think it's just the place of, there are so many different ways to get ketamine. Some people are getting it through the mail and you're doing it online, so there's an access problem, and then there's a container and safety problem, right? And so the different kinds of ethical considerations that need to happen, and the different kind of working with the medical team, those things are things that we need to keep highly,
in the forefront.
Yeah, exactly. Very good.
Exactly. Yeah.
Wendy, would you say your website one more time so if people want to get in touch with you or get trained by you or have questions for you?
Yeah. You can find me at wendybyrd.com. That's the easiest one to remember, but our great practice is Connected Heart Therapy. So we're at connectedhearttherapy.com as well. So either one of those.
Thank you.
Wonderful.
You'll find me. Yeah.
Hey, thanks so much again for joining us. This has been very educational.
Yeah.
So it's so fun to be here.
Yeah, we've so much appreciated it.
Yeah.
And, of course, there's like 1,010 more questions, but that's part of all of our journey, making sure that we get the education we need so we can move forward with it. Right?
Right.
Exactly. And I am happy to, email me, shoot me a question. I'm happy to help people get directed to the right place.
All right. Thank you very much. And
thank you.
Thank you, everybody, for joining us. We really appreciate all of you.
Yeah, until next time.